Hello everyone, welcome to Dental Shots. I'm Dr. Mohanapriya. Today we are going to have the textbook discussion from the Guyton and Hall Medical Physiology. Especially, we are going to see the chapter on hemostasis and blood coagulation in detail. Let's move into the chapter. If you have the 12th edition of Guyton, you can flip to the page number 451, chapter 36, and follow me, or else if you don't have a book also, it's fine. So first they are discussing about the events in hemostasis. Hemostasis, as we all know, the prevention of blood loss, and there are several mechanisms in which the first one will be the blood vessel will get constricted, and later the platelets will accumulate and form a plug to form a platelet plug, and later a blood clot will be formed by the coagulation mechanism, and to permanently close the hole in the vessel, the fibrous tissue will grow into the blood clot. Let's see the detailed discussion of each and every mechanism now. First would be the vascular constriction. We all know that the blood vessel is made up of smooth muscle. So whenever there is a trauma to the vessel wall, there will be a contraction by three mechanisms. One is by the muscle, that is called myogenic spasm, and other by the chemical mediators by autacoid factors, and the third by the nervous reflexes. For whenever there is a cut, what you feel? The pain. The pain will be generated by the sensory impulses in the traumatized vessel, and due to that nervous reflex the constriction can occur. Or some mediators like thromboxane A2, which is a vasoconstrictor substance, which is an autacoid, which is released by the platelets and the traumatized blood vessel, will cause the localized vascular constriction. And also if the cut is very big, then the smooth muscle action will be more when compared to autacoid or nervous reflexes. Okay, so initially in severe traumatized vessel, the greater degree of vasospasm will occur. For example, it may occur even for hours, and so that later it gives some time for the process of platelet plug formation and coagulation to occur later. Next is the formation of platelet plug. So this is a very main mechanism when the blood vessel is very small. Okay, as I said, larger blood vessel, if it is traumatized, the muscular spasm is very important mechanism. But if it is a smaller vessel getting traumatized, that platelet plug formation will be formed and seal the cut. Rather, there will be no blood coagulation mechanism, only platelet plug formation will occur. Now we will see some details about platelets. First, we will see about the origin of platelets. The platelets are originated from the cell called megakaryocytes. This megakaryocyte is the largest among the hematopoietic series in the marrow, and also these megakaryocytes will fragment into platelets. So these fragmented platelets are minute disc shape, which is about 1 to 4 micrometers in diameter. So why do they fragment? When they squeeze into the capillaries, they fragment into pieces called platelets. The platelets are also called as thrombocytes. The normal count of platelet is 1,50,000 to 3 lakh. So the platelet doesn't have a nucleus. That is a very important point. The nucleus is not present in the platelet. The cytoplasm is present, and lot of factors which is present in the cytoplasm contribute to the various functions of platelets. First one is the contractile protein present in the cytoplasm of platelet, that is actin, myosin molecules, and especially there is a contractile protein in the platelet called thrombasthinin, which is responsible for the contraction of the platelet. The second one, which is more important, is that the endoplasmic reticulum and the Golgi apparatus, which is capable of producing enzymes and especially store in large quantities of calcium ions. The third one is that the synthesis of ATP and ADP by the mitochondria in the cytoplasm. And also the enzyme system also synthesize prostaglandins and fibrin stabilizer factor, which is responsible for the blood coagulation. And also certain growth factors are present in the platelet, which is responsible for the repairing of the damaged vascular wall. Now we saw the cytoplasmic content, and now we will be seeing about the membrane of the platelet. The membrane is made up of glycoprotein and phospholipid. Glycoprotein is responsible for the non-adherence of platelet to the endothelial cells. But if the cell is injured with a cut or a trauma, this glycoprotein will be adhering to the injured area of the vessel wall. Okay, and phospholipid will be responsible for the activation of various stages of blood clotting process. In addition, the platelets will have a half-life of 8 to 12 days, and later it will be destroyed and by the tissue macrophage system. Next, we are going to see the mechanism of platelet plug formation. So, whenever the blood vessel is traumatized, the collagen of the blood vessel will be exposed. So, this platelet has a greater affinity towards the collagen fibers, and they attach to that collagen, and immediately it changes its structure, it swells up and it forms radiating pseudopods and started to contract and release all the proteins and factors which is responsible for the attraction of more and more platelet to that area. Thus, first it will be like a loose plug, and later it will be successfully blocking the blood loss by the subsequent blood coagulation with addition of fibrin threads to form around it. Hence, it is forming a unyielding platelet plug formation. Now you can understand the importance of platelet plug formation, because as I said, for the larger blood vessel only, the muscle spasm plays an important role. But for the smaller trauma to the blood vessels, like small injury, the platelet plug formation is very much important. Consider a patient is having a platelet count less than 1,50,000, like 40,000 or 50,000. So even a smaller injury will cause an internal bleeding and it will be a catastrophic event. Hence, the platelet plug formation is very much important. In the upcoming videos, we will be uploading about blood coagulation. Hope you enjoyed about the hemostasis in a short period of time. And if you like the video, kindly subscribe to our channel Dental Shots. Have a great day. God bless you all.